and surgeries for her would be. I still believe that these are what saved her life today. Today I would like to share with you what breast cancer is, what the procedures are, and what you can do to decrease your risk. I'm sure all of you in here probably know what breast cancer is, and I'm sure that all of you know someone who has had it. According to the Mayo Clinic, breast cancer has become the second most common cancer in women in the United States. According to the Breast Cancer Treatment Center, every 12 minutes, one woman dies from breast cancer. Breast cancer comes in many types. The most common type is ductal carcinoma. This occurs in the milk ducts of the breast. Breast cancer does not only occur in women, but in men as well. According to MSNBC, 2,000 cases of breast cancer in men were diagnosed between 2003 and 2008. The causes of breast cancer are still unsure, but there have been risk factors that are linked to breast cancer. One of these risk factors is a gene known as BRCA1 and BRCA2. Just because you have one of these genes does not mean that you are guaranteed to get breast cancer. Although, if you have a family history of breast cancer, you should get your blood checked out for this gene. According to the American Cancer Society, though, only 15% of women who get breast cancer have a family history of this disease. This means that over 85% of women who are diagnosed with breast cancer have no family history whatsoever. Another thing is an imbalance of hormones. The increase of estrogen can cause cells to divide, which, as we know, cancer is caused by multiply dividing cells. The 4 stages of breast cancer. The stage 1 is when your tumor is less than 2 centimeters in length and it has not spread to the rest of the body. Stage 2 is when the tumor is less than 5 centimeters in length and it may or may not have spread to the rest of the body. Stage 3 is when the tumor is larger than 5 centimeters and has spread to areas above the collarbone, which can increase your risk of it spreading to the rest of your body. Stage 4 is the most dangerous and most hard to treat of the cancers, and it is when the breast cancer cells have spread to areas such as your other breast, organs, and your bones. There are many surgeries and radiation and procedures that you can go through in order to cure your cancer. One of these is radiation therapy. The doctors use high-energy x-rays to kill cancer cells. Chemotherapy, as you all know, is where they use a drug to kill cancer cells that are multiply dividing. A lumpectomy is one surgery that a woman can have. This is where they remove the tumor or the lump, and both breasts are saved. A mastectomy is what my mom chose to have. This is where both breasts are removed, and most women have a difficult choice when it comes to this surgery, but my mom always says that she would rather live without her breasts than die with them. A surgery that you can have after having a mastectomy is called a breast reconstruction surgery. This is where women can have their breasts redone and they look almost new. There are different types of breast cancer. 4 main types are infiltrating ductal carcinoma, which accounts for 78% of breast cancers, and this occurs in the milk ducts and breaks through the walls into the rest of the breast tissue. Second type is infiltrating lobular carcinoma. It accounts for 5%, and it is inside the milk-producing glands, and it breaks through the walls and spreads to the rest of the breast. Ductal carcinoma inside too is what my mother was diagnosed with. It is a non-invasive cancer, which means that it does not spread to the rest of the body. It stays in the milk ducts. Lobular carcinoma inside too is also non-invasive and stays in the milk ducts and does not go through the walls. I believe that every one of you who has or will be diagnosed with breast cancer has the choice